told you you fall a lot. Don't think you're just clumsy. She's laughing, and maybe something else.
No, I do fall, though, a lot.
And how a little wine might actually help diabetics. CBS's Lisa Sigell is here now with today's Health Watch. Lisa.
And all Patty's thinking is wine, fall. See,
You know, I
knew what you were thinking.
Like, huh?
I knew it. Hello, all girls. Hi, everyone. Well, first, do you or someone you love tend to fall a lot? It may not be what you think. A lot of people end up in the ER because of falls, but now some experts say they may not be clumsy, but have an infection. Infections can cause low blood pressure, even dizziness. So if you feel unsteady, just ask your doctor if it could be an infection. Quite interesting. A little red wine may be just what the doctor ordered. Some say a glass or two a day could help people with diabetes. Take a look.
Hey there, I'm all done.
51-year-old Garrett Rubin says he has to watch out for everything in his diet since being diagnosed with type 2 diabetes.
Fats and salt and sugar.
Now a new large study published in the Annals of Internal Medicine says a daily glass of red wine may actually help people with his condition.
1 to 2 glasses of red wine for men and up to 1 glass of red wine for women daily at dinner over a 2-year period resulted in lower blood sugars and a decreased development of heart disease.
Red wine also modestly increased levels of HDL, or good cholesterol, and lowered overall cholesterol. Dr. Manisha Sood says researchers have known for a while moderate amounts of alcohol are fine for diabetics, but the jury was out on which kind of alcohol had the most benefit.
So it is the phenols, it is the resveratrol, it is the tannins. You know, they all work together with the ethanol possibly to result in these positive changes.
Garrett says diet, exercise, and medication are still his first line of defense. But now,
Since I have the choice, I think red wine might be the thing.
Okay, but too much alcohol can really mess up your blood sugar. So, of course, moderation and a discussion with your doctor, definitely key. October is Breast Cancer Awareness Month, and all month long we've been sharing stories about survivors, treatments, and resources you may not know about. Tomorrow at 5, Debbie's story.
I knew that my kids needed me. There was no way that I wasn't going to fight.
It was pretty scary.
And I just couldn't see myself living without our mom.
Debbie is a single mom. She was just 40 when she got the news that changed her life. But as she learned, she was not the only one affected. Now what this family learned may help you. It is Debbie's story tomorrow at 5, only on 2. And you know what? We get so many great ideas from you guys. We want to know what's important when it comes to health, medicine, wellness, beauty, even those who inspire you. So share with us on social media and make sure to use the hashtag CBSLAHealth. All right, a lot of people have gone from sitting to a standing desk at work. Now there may be a new trend. Take a look at this. At an elementary school in Northern California, the students are standing. 19 out of 22 classrooms have standing desks. Doctors say it helps kids burn, get this guys, 25% more calories a day.
Ooh.
Yep, and students say it actually helps with their focus. And this is one of the first in the country to almost have their entire school done. So, and there's a fidget bar.
Yeah, I was going to say, what is that?
Yeah, I would show you, but your feet kind of go and you kick.
I see.
Yes,
Which is what I
you
would
can't
be
see,
doing.
but
We need fidget bars.
Yeah, we do.
Do you want a
we
fidget
need
bar?
them now. But as a child, I would have had to have had that because I know, like I was telling Susie and Jackie, there's no way that I could have stood still for that long. I would have been fidgeting and doing this and probably.
I sat, when I had to sit
right,
still.
I know I would have.
See, when I sat still, I like this idea.
Yeah, I think it's a good
And they're
idea.
burning
You sat
calories.
still as a child?
Yeah.